There's Adrian RN here. So, like many of us who are nurses and work very hard for our degrees, we're very upset about this revelation that it is so common and widespread that there are fake nurses going around practicing in nursing, providing patient care, committing fraud, I mean, it's just, it goes on and on. The list goes on and on. So, in the investigation, many of us are doing, because nurses, we're going to get to the bottom of shit, right? So, check this out Tennessee. So, for 6 years, this woman in Tennessee, from 2012 to 2018, I believe, or 2019, she pled guilty. This is Misty Dawn Bacon, 44, of Morristown, pled guilty to wire fraud, healthcare fraud, and using another person's identity to commit federal and state offenses, including practicing a profession without a license. Bacon was sentenced to 51 months, followed by 3 years supervised release. So this is the kind of sentencing you may be seeing in some of these other nurses. Now, this is a little different situation because this particular nurse actually took the licenses and license numbers of other nurses with similar names, created fake credentials. She didn't buy a fake license. She falsely claimed she held nursing degrees from different colleges, and she worked for at least 8 different healthcare providers. So, what it's showing is that we have got to have better oversight within each of these state licensing boards. Hospitals need to take, and employers need to take some responsibility, because, again, remember, some of these nurses that we, in this case in Florida, this whole conspiracy case, they're not working for actual employers. Some of them set up homes, group homes. They started their own businesses. So there's no employer to be screening them. So remember, not all RNs or LPNs are going to work for like some hospital or giant employer. They could be working for a small employer. They could be doing private duty. So this person had access to real patients, rendered actual medical care to numerous patients, including dispensing medications, obtaining invasive access to patients' bodies, and becoming privy to patients' sensitive and private medical information. Due to her lack of qualifications, Bacon created a serious risk of injury and even death to patients she was treating. This risk manifested itself by Bacon performing procedures she was unqualified to perform, not performing needed procedures she recognized she was not qualified to perform, and failing to chart and document patient care in an appropriate fashion. I mean, it goes on and on, because if you didn't go to nursing school, you aren't qualified to do anything in nursing. So we need to really put some pressure here. The DOJ has done a great job. You know, they have clearly uncovered and have been investigating a lot of these cases, but these states need to take some responsibility. This is unacceptable. Unacceptable.